So I have my patient in the position to drain the right and left anterior apical segments. So if I want to do percussion in this position, I could come around behind, and this would be my hand placement. Also for each of these videos or each of these positions, I'm gonna go ahead and ask my patient like if they're okay, if they experience any kind of lightheadedness, dizziness, trouble breathing, etc. This is the position I'm gonna have my patient in to drain the right and left posterior apical segments, and if I want to do percussion, I have my hands placed up right behind those apical segments. This is the position for right and left anterior segments, and so for percussion, my hands would be in this position here. So this is the position for the left posterior segment of the upper lobe, and for percussion, my hand placement would be here. So this is the position for the right posterior segment of the upper lobe, and for percussion, I have my hands here. So this is draining the lingula of the left middle lobe. Patient's at 15 degrees, which I know this is not exactly what we're working with what we've got. So she's going to be biased a little bit. The left side's going to be up a little bit. If I was going to percuss, I would do so in this region right here. I have her move her arm. This is the right middle segment of the middle lobe, and the patient's going to be at 15 degrees, and she's going to be biased a little bit with the right side up to drain that right portion. And if I was going to do percussion, it would be right here in this upper right or middle right quadrant. So this is the position for the right and left anterior basal segments. So if I was going to do percussion, it would be right here in those basal area of the lungs. Patient is at 20 degrees, and she is completely supine. This is the position to drain the, Alright, so this is the position for the left lateral lower segment of that lung. So if I was going to do percussion, I would do so right here. Patient is at 20 degrees, and she is in pure side lying with the left side up. So this is the position for the right lateral segment of the lower lung. So I would do percussion right in this region. Patient is at 20 degrees, and she's in pure side lying with the right side up. So this is the position for the right and left posterior segments of the basal lung. So if I was going to percuss, it'd be this region right here. Patient is at 20 degrees. She's completely prone, and we know that's not completely 20 degrees, but it became a little bit of a safety hazard. So this is the position for the right and left superior segments of the lower lobe. So if I was going to percuss, it would be right here. Patient is completely flat. There's no angle to this.